is the third clinical stage during the perforation of the complete dentures. So now I try to explain to you how to determine the relationship between the jaws, in other words, position of the mandible relative to maxilla. So as you see, this is the third clinical stage after examination of the patient and taking the primary and master or final impressions. So this stage is called recording jaw relations, and the doctor receives the wax record blocks, in other words, occlusal rims from the technician, which are placed on master casts. So you see here master casts and wax record blocks placed on the master casts. It is very important to establish proper relation between the jaw, between the upper jaw and lower jaw, and how to do it. For better remember, these are the dimensions of the occlusal rims. So the maxillary wax rim should be 22 millimeter high. This is measured from the highest point of the sulcus adjacent, so the highest point, to the labial frenulum and to the occlusal surface of the wax rim. So between the occlusal surface and the labial frenulum, this dimension is 22 millimeters for the upper wax record block. What about the lower? The mandibular wax rim should be 18 millimeter high, measured from the deepest point of the sulcus adjacent to the labial frenulum and the occlusal plane. What about the width? The width of the wax record block, so this dimension should be 10 millimeters. I'm sure that you know it because during the classes you try to perform such wax record blocks. Okay. The wax record blocks are used for we need them to determine the proper relationship of the mandibular to the maxilla, and we need them to record this relationship between maxilla and mandibula, to record this relationship on articulators, and of course give such information to the technician. So occlusal rims are used to determine the tooth position also, occlusal vertical high and horizontal jaw relationship, and transfer this recording to the laboratory. Using this, together with the detailed written instructions provided, the technician can set the artificial teeth in the correct position. The main purpose of occlusion registration in a dentulous patient is registration the reproducible relationship of the mandibula to the maxilla at an appropriate vertical dimension for each patient to achieve prior teeth loss occlusion with new complete dentures. And as you can see here, you can notice that on this picture that using the wax record blocks and in the future complete dentures, we can rebuild the occlusal vertical dimension. So at the same time, we reproduce basic functions like mastication, swallow, speaking, with amenities work of muscles and temporomandibular joints. Here you see a profile of an 83-year-old woman with natural teeth. Yes, you see here natural teeth. In a natural dentition, the teeth themselves determine the vertical dimension because we've got some support zones in the posterior part. And of course, the teeth themselves support the soft tissue counters. In a dentulous patient, the prosthetic denture must restore, as you see here, the prosthetic denture must restore this function as well as possible. So here you have, in order, the main stages of recording jaw relation in a dentalus patient. So the first stage is called establishment, the orientation of the occlusal plane. So during this stage, we adjust only the upper record rim. Later, I will explain you in details, step by step, those stages. The second one, this is the determination of the required occlusal vertical dimension. So then we adjust only the lower rim. After that, we should mark the secondary lines, then determine the retruded jaw relationship. So, in other words, the horizontal relation of the mandibula to the maxilla. Then we should connect the record rims in this relation, so in horizontal relation of mandibula to the maxilla, and transfer it on the master casts. And the last but not least, we should select the artificial teeth according to its size, shape, and shape. Okay, so stage number 1. Establishment, the orientation of the occlusal plane. So this is the first stage of recording jaw relations. The doctor may confirm only the upper occlusal rims. What he has to do? First of all, the dentist has to formate the correct shape of the labial, buccal, and palatal surfaces of the wax rim. Later, I will show you pictures. Then he or she should establish the level of the occlusal plane. And finally, he has to conform the rim in the coronal plane and in the sagittal plane. So this is very important, that the stage number 1 is divided into some substages, as you see here, A, B, C, and D. What does it mean? Occlusal plane? So here you see the line which can show us the occlusal plane. And occlusal plane represents the mean of the curvature of occlusal surface of the teeth. As you see here, when we connect all the cusps in the posterior teeth together and also incisal edges, as you see here, we establish the occlusal plane. This is the occlusal plane. Yes, so now substages. So now I will explain to you substage number A. This is the formation, the correct shape of the labial, buccal, and palatal surfaces of the upper wax rim. So adequate lip support depends upon the position and inclination of the labial face of the upper wax rim. Study the patient in full face and profile. Where insufficient support has been given to the lip, only a small amount of the vermilion border will be seen, and the nasolabial groove may be exaggerated. Look at those pictures. So to establish the proper support for the soft tissue, we should put the upper wax record block into the patient's mouth. And then we should establish the position and the shape of the labial part of this rim. And as you see here, in this case, we can notice that this is insufficient support for the upper. yes, because we don't see the redness, for example. And also the angle between the upper lip and nose is obvious. The angle between the nose and the labial and the upper lip should be a right angle, yeah? And the support for the upper soft tissue for the upper lip should be in a good level. What to do if the support is insufficient? We can add some wax, yes, to this part of the labial part of the upper wax rim. If it is too much, we can remove. So all the time we should observe the patient and decide about proper support for the soft tissue in the upper part of the face. Okay, so this is the substage A. Remember, first of all, we should formate the correct shape of the labial, buccal, and palatal surfaces of the upper wax rim. The lip is normally supported by the alveolar process and teeth, which at this stage are represented by the base and rim of the record block. Therefore, the labial surface, the labial surface, must be cut back or added to until a natural and pleasant position of the upper lip and the pleasant position of the upper lip is obtained. So look, here is too much of the wax, so we should cut a little bit of wax in this part. Here, too little, add the wax, and here is the proper support for the lip. Again, here you see the picture of the woman and an upper record block providing inadequate support to the upper lip because the nasal labial angle is obtuse here. So when we add a little bit of wax to this part, to the labial part of the wax rim, this thing provides more support for the upper lip, and the nasal labial angle is 19 degrees, is a right angle. And you see that in this case, the patient looks better. The patient looks better because here we have the proper support for the lips. So many upper occlusion rims will inadequate labial fullness, and if the upper lip is not adequately supported, it will mislead the determination of the occlusal vertical dimension. If the support of the upper lip is insufficient, even with the same height of occlusal rim, the occlusal vertical dimension will appear smaller, as you see here on this picture. And insufficient support, good support, and here we have excessive support. So in this case, we need to remove a little bit of wax from the labial part of the upper wax record block. So excessive support of the lips produces the formation of the overlying tissues and is easily recognized. As the occlusal vertical dimension is too great, the face looks distorted and the lips are incompetent. Okay, so after that, when we establish the good support for the upper lip, then we have the substage B. And the substage B is called establishment the level of the occlusal plane. So the next thing we should do, we should check the height of the wax rim in the anterior part. So this is the adjustment of the occlusal plane in the upper occlusal rim to lips line. The lower border of the maxillar occlusal rim represents the level at which incisive edge of the upper central incisor will be set. So this level decides how much of the incisal edge will be seen below the margin of the upper lip. The amount varies with individuals and is less in patients with a long lip, so the teeth may not be seen, and greater with those who have a short lip. The average amount of tooth exposed is 1 millimeter. So in this substage, we decide how long the future teeth in our complete denture should be. So again, the incisal edge of the rim can be placed so that it is just visible when the lip is at rest. Look here, this is the incorrect because the rim are too long, and here this is the correct height of the rim. Of course, on this picture, the labial part is excessive support, but the height of the rim is correct. Okay. And now the substage C, which is called adjustment in the coronal plane. What about adjustment in the coronal plane? The rim is adjusted so that the occlusal plane of this occlusal plane, anterior occlusal plane, is parallel to the interpapillary line, or alternatively at right angles to the long axis of the patient face. These guidelines ensure that the occlusal plane appears horizontal in relation to the general symmetry of the face. Failure to follow these guidelines will result in an unsightly, lopsided appearance of the finished denture. So remember, this is the rule that the anterior occlusal plane is parallel to the interpapillary line. Of course, how to adjust the upper rim? Of course, we put the upper wax record block into the patient's mouth, and then we check the parallelism between these two lines. How to do it? We can use a ruler, we can use a mirror, explorer, or something which can show us the parallelism between these two lines. Substage D, so sagittal plane. A useful guideline for sagittal orientation of the occlusal plane is the ala tragal line. So ala tragal line, this line, this line. This is an imaginary line joining the lower border of an ala of the nose, here or here, ala of the nose, with the midpoint of the tragus of the ear, to which the occlusal plane is parallel. And this line is called Tamper's line. So we can say that the posterior occlusal plane, this posterior occlusal plane, here, you see, is parallel to Tamper's line.
Professor, I cannot hear you. Hello? Hello, Professor. Can you hear me?
Do you hear me?
Yes, now I can hear you.
Yes? Do you hear me?
Yes, now I can.
Okay, I don't know what happened. But I hear you all the time, so I stopped the presentation. Now you hear me, yes?
Yes, sorry.
Now it's okay. Maybe because of the raining, the connection is unstable. Okay. So again, okay, I try to share my screen. Okay, do you see the presentation?
Yes, yes. The presentation is always fine. It's just when you talk about the last plane, at the last it stopped and then there's no voice anymore. But the presentation is always okay.
Did you see this slide?
Yes, I think we fit after this slide.
After, okay. After is that one. Yeah?
Yes, yes.
Okay. So this is the summary here. Prosthetic occlusal plane is parallel to the interpapillary line in the anterior part, and in the posterior part, the occlusal plane is parallel to the converse line. Yeah? This is the summary of that stage. Sometimes we can do that with using the Fox occlusal plane indicator. How does Fox indicator look like? So here you see the intraoral portion. This intraoral portion is held against occlusal surface of the upper record block. So the intraolar portion is held against the occlusal surface of the upper record block, and the extraoral extension allows the clinician to judge the orientation of the occlusal plane here and with the ala tragal line. The latter line is indicated by the ruler held against the patient's face. And as you see here, the Fox indicator is placed inside the patient's mouth, and the dentist use a ruler to see if the posterior plane is parallel to the ala tragal line, and here is parallel and it is okay. But what about this picture? Look, the posterior occlusal plane is not parallel to the ala tragal line. What we need to do in such case? In such case, in the most cases, we need to remove some part of the wax from the posterior part of the wax record block. So we need to do such things to make it parallel to each other. So add or remove wax. In this case, we should remove wax from the posterior part. Okay, and here you can notice the orientation of the occlusal plane of the upper rings using the Fox occlusal plane indicator, or we can also use disposable wooden thumb spatula. So, as I told you, also the mirror, also the ruler, some things which can show us the parallelism between these two lines. Okay, and again, look at the upper picture. It is shown that the wax occlusal rims, which were made in the laboratory, do not correspond optimally to the reference planes. Because the posterior part is not parallel to ala tragal line, converse line, and here anterior occlusal plane is not parallel to the interpapillary line. Now look at the lower pictures. Occlusion rims adjusted parallel to the reference plane, and on the left occlusal plane is parallel to the right picture, it is parallel to the interpapillary line. Look at the picture on the right side and the upper one. If we have such a case that those two lines are not parallel to each other, we can decide to add a little wax to the, in this case, left side of the upper wax record block, or remove a little from the right side. And then doing that, we made that those two lines will be parallel to each other. I hope that you understand what we can do to make those two lines parallel to each other. And this is the first stage. This is the first stage of the recording jaw relations, and I told you that this stage is called establishment, the orientation of the occlusal plane. And I told you that during this stage we adjust only the upper wax record block. Now the stage number 2. So let's talk about the second stage of the recording jaw relation. It is called determination of the required occlusal vertical dimension. Which methods are the best? We have some mechanical methods and psychological methods. The mechanical ones are facial measurements and profile radiographs. What about psychological methods? We have the phonetics one, psychological rest position. So this is the freeway space method. This is the most frequently used method, which I explain to you later. And the anthropometrical method, which told us about the equality of the 3 sections in the patient face. Look at this face. We can divide the face into 3 parts: upper, midline, and the lower one. And as you see, when the patient has got the proper occlusal vertical dimensions, and in other words, the good occlusion and their own teeth, those 3 parts of the face are equal. What happened if the patient loses his teeth, as you see here? If the patient loses his teeth and there is no support, the lower part of the face becomes shorter, as you see here. And when we try to rebuild the occlusal vertical dimension, we need to make proper high of wax record blocks. So this is one of the methods which help us to make the proper height of the rims of the upper and lower wax record block. Because remember, those 3 parts should be equal to each other: frontal, nasal, and genial. This is the anthropometrical method. And as I told you before, the most frequently used method is a freeway space method. This is the psychological one, which use the psychological rest position. And in this method, we need to know what does it mean occlusal vertical dimension, OVD, and rest vertical dimension, RVD, as you see here. And occlusal vertical dimension, this is the distance between 2 selected points one related to the maxilla and one related to the mandibula, when the upper and lower teeth are in contact. See, the teeth are in contact, and when we measure the dimension between one point related to maxilla and the second point related to the mandibula, these dimensions show us the OVD, occlusal vertical dimension. And RVD, rest vertical dimension, this is the same distance, but when the mandibula is in rest position. So when the teeth are not in contact. See, there is no contact between the teeth. And the difference between those two measurements is called three-way space. This is the difference between those two measurements, three-way space. And this three-way space, we know that this is 2-3 millimeters. Okay. And here you have the rule how to find the occlusal vertical dimension. So occlusal vertical dimension means that we need to find out the rest vertical dimension and then minus 2-3 millimeters, so minus 3 space. And then we have, you have to know some basic mandibular positions. So before we start talking about the methods of determination vertical dimension, so you have to know something about basic mandibular position. First of all, rest position. The vertical and horizontal position mandible assumes when the mandibular musculature is relaxed and the patient is upright. Muscles that close and open the jaws are in the balance and at the same time balance the gravity. So this is the rest position, and there is a gap space existing between upper and lower teeth. So this gap is approximately 2-3 millimeters measured at the position of first premolars. And this space is called interocclusal distance three-way space. This space is wedge-shaped, being larger anteriorly. Then we have muscular position. The vertical and horizontal position of the mandibula to the produced by balanced muscle activity, raising the mandibula from the rest position into initial tooth contact. Then we have the intercuspal position, the vertical and horizontal position of the mandibula in which maximum occlusal contact occurs. And the last one, retruded contact position, movement of the mandibula in a posterior direction from the intercuspal position with light tooth contact. Okay, and here we have the nomenclature for basic mandibular position, because sometimes you can see in the literature the different name of the same position as I mentioned to you before. Okay. And now, there are two methods of measuring the rest vertical dimension and the occlusal vertical dimension. It is not practicable to measure the separation between the jaws intraorally, and therefore measurement must be made between fixed points on the face and on the mandibula. There are two methods commonly employed. The first utilizes a gauge which measures the separation between the lower border of septum of the nose and the lower border of the chin, and this is the Willich-Gogg method, as you see here. And the second involves marking points on the skin and measuring the distance between them, and this is called the two dots technique. The distance between the dots is measured with a pair of dividers, and also we can measure it using the ruler, and also some paper, and by marking the points on the paper. it is most important to appreciate the inherent inaccuracies of both measuring methods. But the most useful one method is the two-dot technique method. Okay. And first of all, we should record the rest vertical dimension using those two methods, then adjust the height of lower record rim to the required occlusal vertical dimension, and then we should formate the correct shape of the labial, buccal, and palatal surfaces of the lower wax record block. And first of all, dentist should record the rest vertical dimension. To coax mandible into the rest position, the patient must be completely relaxed. He should be seated in a comfortable upright position in the dental chair. External stimuli should be reduced to a minimum, as disturbing noises or a bright light shining in the patient's eyes. They are likely to increase activity of the mandibular musculature and thus reduce the rest vertical dimension. And relaxation may be further promoted if the patient's eyes are closed. In the case of Willis Gog, 3 points require attention: the position of the fixed arm under the nose, the position of the sliding arm under the chin, and the vertical orientation of the gauge. So you see here incorrect position and here correct position of this tool. But as I mentioned before, the two-dot technique is most useful technique during the recording jaw relations and finding the proper occlusal dimensions. So now I try to explain to you this technique. How to measure the dimension of mandibular rest position, RVD, in the two-dot technique? At first place, mark the point of the nose and the chin. Yes, here. This should be done with a eyebrow pencil, which can be easily removed, or small pieces of sticky plaster can be stuck to the skin to carry the markings. Second, ask the patient to open wide and close his mouth a few times, and then to connect upper and lower lip, articulating the letter M, like this. And when you try to say letter M, like this, you can notice that your lips are in the light contact and your teeth are not in contact. So we can say that this is the freeway space between them. So thanks to that, we can record the rest vertical dimension. So when you satisfied that the mandibula is in rest position, record the measurement between the nose and the chin markers. And this can be done with calipers or by placing a sheet of cardboard against the nose and chin and making marks on it. The RVD should be measured few times and the score averaged. Excuse me for a while. Okay. And then it is time to start adjusting the height of lower record rim to the required occlusal vertical dimension. So then insert the lower base and occlusal rim. Note occlusal vertical dimension using the same points of reference as were used to measure the rest vertical dimension. Reduce the lower occlusion rim until the separation between these markers is the same as that which existed in the rest position. So now remove material from the lower rim until the occlusal vertical dimension is 2 or 3 millimeter less than the rest vertical dimension. So vertical dimension is correct when the lips contact each other lightly before the wax rims contact when the mouth is closed. And it is important that 3 parts of the face are equal, as I mentioned before: frontal, nasal, genial, and this is the anthropometrical method. So this anthropometrical method is helpful for us. So we can say that we can use those 2 methods together: anthropometrical one and the three-way space method. So we use them together. And here you can see the profile and frontal photographs of a 65-year-old patient. On the left side, the vertical dimension is insufficient and produces a pouting appearance. When the patient closes from the rest position, she has the feeling of closing into a void. In the middle one, correct vertical dimension, the face is properly proportioned and the lips touch one another easily and naturally. And on the right side, vertical dimension is excessive. It is difficult for the patient to bring the lips together. She senses that she has too much in her mouth. Yes, we can notice it here. Of course, in such case, it needs correction. We should remove some part of wax from the lower rim to make it to make patient more comfortable. Okay, and finally, the dentist should formate the correct shape of the labial buccal and palatal surfaces of the lower wax rim to conform to the neutral zone. What does it mean, neutral zone? The neutral zone has been defined as the area in the mouth where during function the forces of the tongue pressing outwards are neutralized by the forces of the cheeks and lips pressing inwards. The aim of the neutral zone is to construct a denture in muscle balance. That is a denture which is in harmony with its surroundings to provide optimum stability, retention, and comfort. And we can notice here on those pictures, at the top of this picture, the wax rim is too high and too wide. The border of the tongue lies below the plane of the occlusal rim. If the posterior teeth were set according to this guide, the occlusal plane would be too high in relation to the tongue, and the patient would have difficulty in positioning foot on the occlusal surface of the teeth. At the bottom of this picture, occlusal rim adjusted the border of the tongue. The denture where will have little trouble holding a balls of food between the teeth using the tongue and cheek. If the other hand, the occlusal plane is located lower than the tongue's border, and the unpleasant result will be frequent tongue biting. So you see that here is too much wax, and of course, in this case, we should remove that wax. And here you have a photo of wrong adjustment of the occlusal rims to the neutral zone, the upper one, and the right adjustment in the lower one. You see that this is too much wax, and here the proper size of the lower rims. Again, neutral zone, what does it mean? That the forces which goes from the tongue and goes outward are balanced with the forces produced by the chin goes inward. This is the neutral zone. Okay, and the third stage, marking the secondary lines. So when we finish measurement adjustment of occlusal vertical dimension, there is a stage of making the secondary additional lines. And first of all, let's talk about the midline. Midline, according to the midline of the body and long axis line. It indicates where is the location of connection of the central incisors. So look, when we try to mark the midline, we should, of course, relate it into the patient face and relate it into to the midline of the face. And the midline later show us the position between two central incisors. Now the canine lines, they are marked on the rims according to the line of ala of the nose. Look, ala of the nose, yes, ala of the nose, and they are marked according to the ala of the nose. They indicate where there is the middle of the canine, the middle of the canine. Between these two lines, there are 4 incisors and a half of the canines. As you see here, 4 incisors, 2 centrals, 2 laterals, and half of the one canine and half of the second canine. And the last one, high smile line. High smile line is placed according to the upper lip line when patient smiles. So we ask patient to smile and we try to mark the smile line according to upper lip. Okay, and the 4th stage, determination the retruded jaw relationship. So we need to establish the horizontal relation of the mandibula to the maxilla. Centric jaw relations, this is the relation of the mandibula to the maxilla when the condyles are in their most posterior superior and straight position in the glenoid fossa, from which lateral movements can be made at the occluding vertical relation normal for the individual. Centric relation is a relation that can exist at any degree of jaw separation. And how it's look, you can notice here the head of the condyle is situated as far superior and anterior as it possibly can within the mandibular fossa. And this is the central position of the mandibula in the central fossa. That was the TMG, and here you have an X-ray. Here are the head of mandibula and the mandibular fossa. This is the head of the mandibula and mandibular fossa, and we see that this head is in the central position in the fossa. But of course, making the jaw relation, it is impossible to make an X-ray or tomographic or the CBCT, for example. So I try to show you this picture to show you the position of the mandibula in the glenoid fossa, but of course we have some methods to do that. So here you have the technique of mandibular manipulation. We have an active ones with patient cooperation. When we ask patient to swallow, to relax and bite with posterior teeth, and also when we ask patient to touch with the tip of his tongue to the border on the palate. So we ask the patient to touch the vibrating line, aha line. So these are the methods which makes the patient jaw go back. And the passive method with doctor help, this is the one hand grab method by Stewart, as you see here, when we put our fingers onto the patient mandibula and try to push back mandibula back. And the second method, directing of the mandibula up and backwards with use of both hands by dorsal. So then we use both hands and try to push mandibula back. And during this stage, we try to use both methods, active and passive together. So I ask patient to swallow and to touch his tongue to the vibrating line, and at the same time, I try to push mandibula back using my hand. And then I'm sure that I find the proper position of the mandibula to the maxilla, and I ask the patient to close his mouth. Again, so this is the two hands method by Dawson and one hand method by Stewart. Okay, when we find the proper position of the mandibula to the maxilla and ask the patient to close his mouth and connect the rims according to this position, then we need to make a spatula test, knives test. How to do that? So we put the knife between the wax rims, and if there is no space between them, this is the correct, this is the negative test. And when we find out a space between those two rims, this is the incorrect, this is the positive test. So what we should do in such case, we need to add some wax into the lower rim, just to have the negative test when we there is impossible to put the knife between these two rims, which are connected together. So again, the spatula knife test, the rims contact each other, they should contact uniformly. Okay. And the next thing we should do, we should connect the record rims in horizontal relation of the mandibula to the maxilla and place them to the casts. What we can do, we can warm the wax rim here, so make it softer, and then ask the patient to close his mouth, so the upper and lower connect together because they will be softer. Or we can use staples, as you see here, or occlusal keys. What does it mean, occlusal keys? We have some hole in the upper rim and some key in the lower rim that's suitable together. And the last thing in this recording jaw relation stage, selection of the artificial teeth. We need to choose the proper size, proper shape and shade in the last stage of the recording jaw relation. In 3 weeks, there will be the lecture about the proper selection of the artificial teeth. So then I will explain to you how we can choose the proper size and the proper shape of the teeth. We have some rules. So during this lecture, I will explain it to you. Okay, so that was the recording jaw relation stage, the third stage of performing the third clinical stage of performing the complete denture. Maybe now there is a time to show you the film, because maybe it will be helpful for you to understand what I tried to explain to you today. Okay, so let me show you the film. Of course, that film is from internet, but maybe it will be helpful for you. Do you see the film?
Yes.
Okay.
Place the mandibular record base in the patient mouth and evaluate the position of the occlusal plane and do all necessary adjustment for the mandibular wax rim. Mark a small dot on the nose and the chin to serve as reference points. Ask the patient to say Emma several times and relax his jaw, or swallow and relax his jaw several times. Use a tongue depressor blade to record the distance between the reference points when the patient jaws are in the physiologic rest position. This measurement on the tongue blade is the vertical dimension of rest. It should be relatively constant after several repetitions. Only maxillary record base and occlusion rim inserted to provide lip support. Mark the tongue depressor blade 3 mm short of the vertical relation of rest. This is the vertical relation of occlusion for most patients. The occlusion rim is adjusted by trimming the wax rim with a heated spatula or knife. Replace the record base in the patient mouth and verify using the tongue blade that you have established the vertical dimension of occlusion you desire.
Okay. Okay, do you hear me?
Now, yes.
Okay. I hope that film helped you a little bit. Of course, the presentation and the film is placed on the Moodle platform if you would like to see more. And now, please tell me, do you have any questions?
No.
Okay, if not, so again, please turn on your cameras because I need to make another print screen. Okay. Maybe we should wait a while. Okay. So smile, please. Thank you so much. And now the list. Okay, thank you very much. So if you don't have questions, so that's all I prepare for you for today. We see each other in 3 weeks. Yeah, I think on the 9th of November. And then I will have the second lecture with you. But of course, the next week you've got the lecture with Dr. Beata. Yes? Or Dr. Dorota, I'm not sure. Dr. Dorota or Dr. Beata, I'm not sure. And we together meet in 3 weeks. Okay? And then I will tell you everything about the positioning and positioning the teeth in the complete denture. Okay, so thank you so much.